the definition of hypertension. Now, basically, I think before we start, I will want to advise everybody that with the prevalence of hypertension among our society, right, especially for the old people itself, I think every household should own a blood pressure meter, right? This is my first advice, right? So in all practical purposes, I think having a blood pressure meter is a very valuable self-care tool for us itself. And it's not expensive nowadays. I think reasonable, well-established, certified blood pressure meter that the one shown in this picture itself, you probably can buy for $50, $60 with features that's fully actually included in terms of the pulse rate as well as rhythm measurements. Okay, having said that, all right, what is the definition of hypertension? So when we measure with the blood pressure meter, you will get two readings. The reading on top is actually the high reading, which is actually the systolic blood pressure. It's the blood pressure where your blood pumping, when your your heart is pumping, then the blood pressure on the artery. This is reflects the blood pressure in there. So we call it systolic blood pressure, SBP. Now, I need to make sure that everybody understands because there's a lot of chart subsequently in our session that will refer to SBP, DBP itself. So basically, you know that this means referring to the blood pressure of the systolic or diastolic. The lower number actually is the diastolic blood pressure. Actually, is the blood pressure in the artery when the heart is not pumping at rest. Right? So basically, it's called diastolic blood pressure. So there's two numbers. Whenever you measure your blood pressure, there's two numbers. Now, clinically, if your numbers is 140, the high number is SBP is 140, and the low number is higher than 90, right? Then you are considered suffering from hypertension, which means that you are in a clinical hypertension condition, which means you need clinical intervention. Basically, if you are in this state, you will definitely need to actually take medication to address the issue itself, right? So this sets a baseline of what we're going to discuss today, right? So actually, the blood pressure of the 140/90, above 140/90, is actually just a reference. But in reality itself, what is considered normal? Now, you can see from this chart here, the real normal number that we normally accepted as the normal one is actually your blood pressure below 120 and below 80, right? That is considered a normal. Obviously, as we age, the normal blood pressure level might raise as we age progressively. But currently, the definition is that if you are below 120 and 80, you're considered normal. You don't have a problem itself, right? Now, we have a different stage of blood pressure itself, where elevated blood pressure above 120, right? And still your diastolic blood pressure is below 80 itself. We basically consider that you have slight elevation, but that's not something of concern itself. But currently, we consider that you are suffering from hypertension stage 1. If your blood pressure, the upper number is 130 and above 130, and the lower number is actually above 80, right? So that is considered hypertension stage 1. Remember what we mentioned earlier, the definition of hypertension is actually above 140 and 90. So this is actually, in our current context, if you look at this table, it's already hypertension stage 2. This is a stage whereby the clinical intervention is mandatory, right? Whereas when you are in elevated or hypertension stage 1, you might not require mandatory intervention. So that's all, right? So of course, if your blood pressure is above 180 systolic and above 120 diastolic, then you actually are suffering from what we call hypertensive crisis. Actually, under this circumstance, this condition, you have a lot of acute risk of having strokes or so what do you call strokes or actually heart attack itself. So therefore, we will talk about this in the subsequent presentations. The next presentation about hypertension crisis issue. Okay, now what are the common symptoms if you're having your blood pressure? So one of the very common one is actually the headache, especially actually at the occipital level region, which is actually the back of your neck. This is a area whereby if you are having this problem, these are one of the very common places where you're having headache when you're suffering from hypertension. So one of the very common actually manifestation of it is actually the headache that's occur in this region itself. Then of course, if you are having hypertension, you will find that you may have a dizziness or lightheadedness, right? Your vision can be blurred, right? And then if it's more severe cases, sometimes you can suffer from shortness of breath itself, or irregular heartbeat or rapid heartbeat itself. Anyway, if you are suffering from chest pain, then there is actually become a crisis already, because chest pain very often indicates the sign of heart attack. So this is actually a more of an acute symptom already. Nosebleed, not common, but do have. And if you are hypertension, do be careful. Because you are nosebleed, do be careful and just check whether you are suffering from any hypertension issue itself. Now, fatigue and confusions are there, but these symptoms are very common across a full spectrum of other problems as well. Tinnitus, this is actually the ringing or bustling in the ear. These are also actually one of a very common clinical manifestation of hypertension. But the causes of ringing ear can be other causes as well. Can be infection, can be other causes. So therefore, it's hard to actually pinpoint that. But this can be collectively, if you see all these symptoms, it can be a sign of actually having hypertension, suffering hypertension. Now, these symptoms are only indicative itself. So that's why that I mentioned that it's best to have everybody in the household to have a blood pressure meter, because if you are suspecting you're suffering from some form of hypertension, the best way to detect that or to diagnose that actually is to go for the measurements itself, right? Okay, now how prevalent is hypertension? Well, if you look at it itself, in terms of the Lancet reports on the worldwide side, hypertension affects up to 40% of the adult population worldwide. It's a very, very wide spectrum that affects everybody. If you look at it in Singapore, in fact, it affects up to 37%, right? Malaysia is higher, 40%. Indonesia and Malaysia are in the same class itself. They are all 40% of the adult population are suffering from hypertension, right? Australia is better. In fact, if you look at it itself, it's about 10 points down. It's 29%, right? And China is 27%. So reality is that the Southeast Asian nations itself, right, actually are suffering from very high prevalence rate of hypertension. Now, you look at Singapore statistics itself. The hypertension, of course, increases. The prevalence rate increases with your age itself. But above 50 years old, and more than 1 in 2 Singaporeans are suffering from hypertension. That is how prevalent is hypertension, even in Singapore itself. That means that if you are above 50 years, you can see that at least 2% in that, I'm quite sure one of them will have suffer from hypertension. So this is a very high prevalence rate itself. Right, okay, now let's look at what are the risk factors that can lead to hypertension itself, right? So this is a collective of a few studies because it's very challenging to actually really get very so credible information on risk factor, because the way to measure the risk factor or to analyze the risk factor and the risk, the relative risk itself is very challenging, and because of the lifestyle we are and homogeneity of the of us in the study itself. Now, but in here, right, you can see from here that obesity accounts for the single highest risk factor in causing hypertension, right? Followed by type 2 diabetics, followed by genetic, which is family history, which is a genetic factor, followed by hyperlipidemia, which is basically lipid disorder, high cholesterol problem. Then followed by a lifestyle of smoker, right? Followed by lack of sleep or insomnia, having sleeping problem, and physical inactivities is about 1.14. So you look at it itself, the risk, the odd ratio, basically the multiplication of the risk you have itself. We are obese itself, we are about 5 times higher risk of suffering from hypertension compared with a person not obese. If you are type 2 diabetic itself, you are 2.6 times higher risk of suffering from hypertension itself, and so on. All right. So therefore, today we will talk about the key risk factor, right, and how to manage it, how to prevent and basically reduce the risk of the hypertension. Now, look at obesity first, since it's the single biggest risk factor for hypertension itself. Now, the fact is that if you look at this chart in front of you, whether you measure your obesity by BMI or you measure by your waist circumference, it really doesn't matter, right? The higher your BMI or your waist circumference, the higher will be your blood pressure. That is a statistical fact itself. So you can see from here that the more obese you are, more overweight you are, the higher will be your blood pressure. And then it's very simple. Logic is very simple because the more heavier the weight is, the harder your heart have to pump the blood through your body. Right? The pressure have to be higher for the blood to be able to pump effectively to your body itself. So therefore, you can see from there that doesn't matter how you measure, whether it's waist circumference or BMI is the same, right? And there's no real difference between male and female, right? Both male and female, if you are obese or you are overweight, your blood pressure go up, all right? Okay, now let's look at how the BMI and the risk of hypertension is associated based on, if you are normal, basically there's a baseline. Overweight, your BMI is 23 to 25, right? You have 1.66 times the risk of having hypertension. But if your BMI is 25 to 30, right, you have a 2.56 times risk of higher hypertension. So therefore, actually, as you get more and more overweight, actually the risk of hypertension increase very exponentially. Basically, you can see that from there itself, the extreme, your BMI is more than 30, actually is about 4.7 times higher risk itself, right? Now, so if you are to reduce your weight itself, right, there is a study show that for every kg of weight loss itself, you are able to reduce your blood pressure, systolic, the top number, or the diastolic, the bottom number, by at least 1 mark, 1 mmHg, or your mercury, 1 mm mark itself. So at least it's close to about 1 mark for every kg of weight loss. Okay? Right. Now, so, okay, let's talk about after that, what are the food that can increase your blood pressure? Now, this is more important because although that we never stated diet is a very major contributing factor, but actually diet is a very important indirect contributing factor to hypertension itself. And therefore, we need to focus on the underlying causes of it itself, and diet is one of the causes of obesity anyway. So therefore, let's look at the food that can increase the blood pressure. So there's actually basically 2 types of food that we have to be careful with our hypertension. One is the salt, amount of salt in the food, right? We all know, I think most of us will probably know that salt affects us, especially more sensitive to people who are hypertension, and alcohol intake itself, right? Then there is the third compound that I want to put it here. This compound is called licorice. Licorice actually in Chinese is a ganchao. It's a very common TCM ingredient in all the TCM concoction. Very common. Most of the TCM formulation or concoction itself would have the licorice as one of the ingredients. Licorice itself as a very common ingredient for neutralization of the various what they call herbs potency or toxicity itself. So it's very common use itself. Now, unfortunately, licorice actually can cause serious side effect by increasing the blood pressure itself. And licorice can also decrease the potassium level in our body. So therefore, when you are having hypertension, do be careful about the TCM formulation, decoction that you take itself. Watch out for the ingredients of containing formulation containing licorice. So this is actually can also increase your risk of having hypertension. Okay, now let's look at the sodium. Since we talk about sodium is a key factor. How does sodium affect our blood pressure? So you can see from here, right, that we are not talking about totally no sodium. In fact, I think there's an average sodium that we take. We are assuming the sodium we take normally is at about 2 grams per day. This is a reference level of it itself. You can see this chart that both the systolic blood pressure and the diastolic blood pressure itself, as your sodium intake increases itself, right, your blood pressure increases linearly. So as you increase your intake of sodium beyond the 2 grams per day nominal average itself, right, then your blood pressure, both the systolic and diastolic blood pressure, increase linearly according to the dosage. So this is very important. It's very important. That means that if you are having hypertension or you do not want to have hypertension, you need to actually control the diet, the sodium in the diet itself. Okay, let's look at another one, another perspective itself. So if we look at how the dietary salt intake affects people with hypertension compared with people without hypertension, right? Now you can see from this chart itself that the salt intake will increase the blood pressure for both hypertensive patient as well as normal healthy patient. But for hypertensive patient, the increase of the blood pressure is more steep, which means it's more sensitive, right? So that means that if you are suffering from hypertension, right, your sensitivity, your blood pressure is more sensitive to the salt intake than a person that is not suffering from hypertension. So, which means that if you are hypertensive person, right, you should actually be more careful about the salt intake than a person that's not hypertensive. So therefore, it's very important to know that the hypertensive patient have actually higher sensitivity to the salt, and as the salt increase, the blood pressure go up very much more faster. Okay, now another component we are talking about actually the increase of blood pressure due to alcohol intake. You can see from here again, right, the relative risk of actually suffering from hypertension as your alcohol intake increases, right, itself actually it does also linearly increase in this curve, right? So therefore, it doesn't mean that actually you should abstain totally from alcohol, but a small amount of alcohol, it doesn't have a problem itself, right? But beyond 12 grams per day of alcohol, then the risk of having hypertension increases proportionally. Okay, so the increases of alcohol on the hypertension on your blood pressure is both systolic as well as diastolic. Both are affecting. It means that the high number and the low number both are actually equally affected itself. So it doesn't increase only one number, it actually increases both numbers together. Okay, so now, okay, so much about some of the risk factors we talk about on the diet itself. Let's talk about how hypertension is being classified. Now, hypertension can be classified based on the underlying causes, right? We can actually classify under the essential hypertension, which is primary hypertension. It's a hypertension there is no identifiable cause itself. This is the most common cause of hypertension in our population, right? 85% of the people who suffer from hypertension actually fall into this category of essential hypertension, which means that there's no real identifiable cause. There's another category of hypertension we call it secondary hypertension. It's not the hypertension is not important. It's secondary is just a term referring to hypertension that have one distinctive cause. That means that we know exactly what triggered that itself. All right. So these are usually related to diseases, right? So like adrenal diseases, kidney diseases, obstructive sleep anemia, pregnancy, right? Medication and cause, and thyroid diseases as well. We will discuss this in further detail on this as well, on secondary hypertension. So we'll talk about secondary hypertension first, because these are known causes. Once you have identified the causes itself, they are actually what they call remedies on that. They are actually a treatment option for that. Whereas the primary hypertension itself, we really don't have what they call a targeted solution, and therefore we have to work on a much more broader spectrum of remedies itself. Okay, let's look at the secondary hypertension cause, right? Among the secondary cause of secondary hypertension itself, you notice that in this chart, all right, the obstructive sleep apnea is actually the single highest cause, right? And then followed by a primary aldosteronism. This is actually the endocrine diseases itself. Then all the other diseases itself, actually, the contribution to the secondary hypertensions are actually not high itself. The highest one actually is obstructive sleep apnea, which is the OSA itself. We will discuss this in more specific detail. You can see from here, right? The OSA basically is a form of sleeping disorder, right? So basically, if you are suffering from there itself, one of the very common and most profound clinical manifestation of an OSA is actually loud snoring when you sleep. When you sleep, you snore, right? And this is actually one of a very clear indication of you might be suffering from OSA itself, right? And then obesity and daytime sleepiness. These are quite common in people who suffer from OSA. And the prevalence rate is about 18% of hypertension in the hypertension population. It means that among the hypertension population, it's about 18% of it suffering from actually the OSA, suffering from OSA on that. And the other one actually is endocrine disorder itself. Basically, the clinical indications of it itself, usually you will have low calcemia, hypocalcemia. Okay, basically low potassium itself. Then you have a metabolic acidosis. But these are less common. It's about 5 to 10%. Let's look at the first one first. Okay. Now, OSA is one of the single largest cause of secondary hypertension, right? Now, what is OSA? OSA actually is a condition where the airways become blocked during your sleep. So when you sleep, right, you look at it itself, normally this airway is open, right? Now, when it's blocked, you will actually find that people who are blocked will have snoring. Snoring because it's a sound that the air tries to expel themselves through the blockage itself. That's where the snoring is itself. So therefore, this is actually causing intermittent hypoxia, which is lack of oxygen itself, right? And which in case over time, this actually condition can raise your blood pressure. In fact, this is one of the single biggest cause of secondary hypertension, right? Now, okay, you look at people who suffer from OSA. If you are suffering from sleep or OSA itself, what are your risks and complications? Hypertension, the risk is 1.37, right? So actually, if you compare with that itself, actually, risk is relatively low compared with other risk factors for people who suffer from OSA. Now, the risk of having a what we call coronary artery diseases itself, the heart diseases itself is 1.3. The risk of having a stroke is 1.97. It's actually close to 2 times than compared with normal people who don't have this condition itself. Now, if you look at it itself, the risk of having a heart failure is 2.38 times. It's even higher than the stroke, right? The risk of suffering from type 2 diabetics is 2.3. And the risk of suffering from metabolic syndrome, which means that a diabetic condition plus either is a hypertension or plus either is a lipid disorder condition itself, is 3 times itself, right? So then the risk of having depression is about 2 to 2.5 times. And if you're driving, the risk of having a car accident actually is 2.5 to 7 times. So it's very dangerous for people who suffer from this because they are often very sleepy, not alert, and therefore actually they cannot concentrate in the driving, right? And the risk of dying is actually 3 times. So therefore, actually, this is a quite serious medical condition, a sleep disorder condition itself, right? So apart from it being a major contributor to the hypertension, basically the complication of having OSA actually is more than that. You actually can have cardiovascular diseases risk, you have a diabetic risk as well. Okay, now what are the treatments since we know this? Now in here, there's a chart for us. I will share with you some of the, we need to understand how this happened. You look at it, itself, people on this chart is the sleep span in body position, in the way we sleep. So people who are normal person, normally you have most of the time spent in the lateral position, which is actually slanting on the side, sleeping on the side. Most of the time, and then you do have some about less than 40%, 30% of the time you might spend in supine. Supine is actually facing up. Your back lying down, you're facing up flat itself. Okay, right. But for people who suffer from OSA, the time they spend in the supine positions are longer compared with the time they spend in the lateral position. Right. So that is the reason why, because as you sleep longer with your face up in supine position, right, and therefore you will have a higher risk of actually having obstructions of the airway itself, right? So what are the current treatment options for people who suffer from this? It depends on the state of OSA. So if you're suffering from very mild condition, a mild state of it, you might have some snore, but the snore is not loud, a bit occasional itself, right? I think lifestyle changes is one of the actually modern treatment recommendation. So first thing is that, of course, you will need to lose weight if you're obese itself. The recommendation is to exercise, quit smoking, right? Avoid consumption of alcohol, especially at night, and avoid sleeping pills and sedative. So these are the current first-line recommendation for people who suffer from mild OSA. But if you are suffering from moderate OSA itself, right, there is a treatment that very often proved to be more effective. It's actually, we call it position therapy. That means that in a sleeping position, you try to prevent from lying in a supine position and promote side sleeping. Right. So try to actually have something that's put on your back so that you can sleep on the side. Now this will allow your air passage not to be blocked. So for people who are snoring, okay, so this is actually a technique that you all can learn and try to practice, right? Sleep more on the side, right? And if you sleep more on the side, you find that your sleep quality will be better because your airway are not blocked. So now that's very common. I can tell that OSA is a very common problem for old people, right? So one of the way to actually able to mitigate the OSA complication or problem is actually through the position therapy itself. So this position therapy are not something that is very complicated. We can do it, but you need to try to orientate your sleeping position, right? Try to do that. right? Of course, if you are suffering from severe OSA itself, then there is actually intervention. There's a you see a doctor. Doctor will actually have a device that you can see from here that mount on your mouth, and while you sleep, actually this is a device that actually continuously push the air inside your lung itself. Now, it's not a really good way. If you look at it itself, to be honest, if I look at this itself, I can't sleep. If I wear this device, I don't know I can sleep anyway. It will make it worse. So therefore, this is, although there is a gold standard, most effective intervention for treatment for OSA, but I will put it that way, right? If you can try to do a precision therapy, right? You are going to, if you're suffering from there, you have no choice. I think this is going to be a very, very uncomfortable types of sleeping position you have, right? So remember, this is the most severe, most prevalent secondary cause of hypertension itself. And it's very common of hypertension for people who have this, will have hypertension, right? Okay, now the other secondary cause of hypertension actually is endocrine Andrea disorder. What is this itself? We call it primary endothelium, PA. This is the most common cause of endocrine hypertension. Very common because of your basically your endocrine disorder problem, and very often this is because of some benign tumors in the underlying glands, or actually some inherent congenital endocrine disorder itself. Now, so this disorder conditions often cause overproduction of androstenedione, now which is a hormone itself, right? And the characteristics of this condition actually is that you will suffer from hypertension with low blood potassium level. We call it hypokalemia, which is the potassium level is, you are having a typical symptom of low potassium in the blood, but you are suffering hypertension, right? So what are the complications of suffering from this condition? Basically, you will suffer from irregular heartbeat, which means that you have a higher risk of having heart attack, and you will suffer from the higher risk of kidney failure. And this is actually a condition that needs to be treated. So if you are suffering from this itself, the PA is a curable cause of secondary hypertension. So that means that it's a treatable disease condition, and if you are detected, right, you should get treated. That's all. So therefore, do not self-medicate on this. So you can be treated. And this usually in the diagnosis, if you have hypertension, doctor will try to exclude whether this is one of the causes. Okay. Now, there are other secondary causes of hypertension, among them the medication. Now, these are important because there are some of us that are having hypertension and we do not know why, but there are medication that can trigger that. And I will list here the common medication that can cause hypertension. Among the medication I listed here itself, two medication most often are taken on the over long term. One is the oral contraceptive, one is steroids, right? So normally oral contraceptive and steroids are taken over a longer period, over certain medical condition, for instance, for steroid itself. So therefore, people who are taking steroid itself should be aware and conscious about that the side effect of the steroid can cause hypertension, right? Other medication itself, like the NSAID itself, these are actually the anti-inflammatory painkiller drugs. This is only when you are actually suffering from some form of pain, and you take this itself. And decongestant, basically when you are actually suffering from actually flu, so you are taking a cough syrup and so on. These conditions are temporary. They are transitional. So therefore, I'm not too concerned about that. While you're taking this itself, this medication itself, you got to be careful about your blood pressure, especially if you are suffering from hypertension. Do measure your blood pressure. So that means that if you are suffering from hypertension and you are taking a painkiller or a cough syrup, so on, right? Do take care of your blood pressure. Make sure that they don't overshoot yourself, right? And of course, chemotherapy drugs can cause that. And also some other immunosuppression medication itself can also cause hypertension. So, right? So the option, the treatment for this itself is that basically for steroid and oral contraceptive itself, maybe you can ask if you are suffering from hypertension because of this medication, you can ask for doctors advice whether you can discontinue or switching to medication that doesn't contribute to your high blood pressure, right? But other than that itself, while all the others itself, you can actually use some supplement, which I will discuss later, shortly, right? To mitigate the drug side effect of hypertension itself. That means this is where the supplementation comes in, where I think you can make use of supplementation to help to reduce the hypertension risk itself or mitigate the hypertension. Okay, now what are the other secondary cause of hypertension? Chronic kidney disease. This is something that I want to mention is because actually chronic kidney disease is a chronic condition that actually affects a wide spectrum of actually that means that it happens in a lot of other conditions as well. Chronic kidney disease patients are often diabetic patients, for instance. They are very often diabetic patients. And chronic kidney disease patients are also very often hypertensive patients. Right? So therefore, they are actually interrelated in a lot of aspects. But let's look at how CKD patient itself, and this is a stage of actually what we measure CKD, and that means there is a measurement of actually our kidney function. If you look at it itself, you normally go for the kidney function test. The doctor will actually do a kidney function test, and in there's a measurement, a marker called GFR, or in fact in Singapore we use the eGFR itself. Actually, this is a measure of your glomerular filtration rate, which is your filtration, kidney filtration function. So you look at it itself, right? If your kidney is healthy, right, your filtration function actually is actually above 90. Right now, when your kidney is not so function is not healthy and its function is getting weaker and weaker itself, then this number will be dropping until you reach a stage whereby it's zero. When zero means basically the kidney have no filtration function, and therefore it basically represent a kidney failure. Now, the early stage of actually kidney dysfunction or kidney function drop, basically at the stage 1, there is actually between your filtration rate of 90 to 60. Right? Basically, there's not much of a symptom. But the immediate symptom after that itself, where your kidney beginning to fail further, will be hypertension. Then you find that you also find protein in your urine. These are the most common clinical manifestation of chronic kidney disease as they progress, right? So as they progress further, then you will suffer from anemia and bone diseases and so on and so forth. But the early symptom of actually kidney disease itself actually very often is hypertension. So hypertension and chronic kidney disease are very much interrelated. Okay, now you look at it, how prevalent is actually the hypertension in chronic kidney disease patient, right? You can see from here, right? If you do not suffer from chronic kidney disease, the prevalent rate of hypertension is actually about 25%, right? But if you are suffering from progressively worsening chronic kidney diseases itself, the prevalent rates of suffering from hypertension goes up very, very drastically. So take the example of your stage 4 and 5. That means this is usually the late stage chronic kidney disease patient. If you are suffering from there itself, I can tell you that almost 90% of the patient will suffer from hypertension. So this is almost that if you are suffering from late stage chronic kidney disease, I'm quite sure that you will also have hypertension problem. It comes hand in hand, right? So in here, there's another chart showing you that the blood pressure in chronic kidney disease patient, right? You can see from here, right? 62% of the chronic kidney disease patient itself suffer from hypertension, which is with a number that's above 140 and 90, which is a stage 2 hypertension itself, right? 27% suffer from stage 1 hypertension, right? So if you add these two together, it's almost 90% of the kidney patient, chronic kidney disease patient are suffering from hypertension. So you can see how prevalent is it. So they are actually goes hand in hand itself. So people who suffer from chronic kidney disease, almost certain you have to take care of the hypertension itself because hypertension goes with them. Okay, so you can see from here that the CKD is both a cause and a target, right? Now you look at the other way around. In fact, hypertension is the second leading cause of kidney failure. So if you're a kidney disease patient itself, diabetic is the primary cause of kidney failure, but hypertension is the second leading cause of kidney failure, right? And if you look at this chart itself, right? If you are suffer from hypertension, especially in the stage 1 and stage 2, you can see from that the probability of free from chronic kidney disease itself drop as your age go on. That means that if you are having a long-term hypertension patient, right, and especially in the stage 2, which is called the stage 2 hypertension itself, your probability of suffering from chronic kidney disease is almost 50% after your 5 or 6 years. So it's almost certain that you will suffer from chronic kidney disease. So these two goes hand in hand in that. And so when you deal with chronic kidney disease patient, you need to actually address the issue of hypertension. Okay, another one, which is actually the cause of secondary hypertension, is during pregnancy itself, right? This I will briefly go through it. It's not something that is actually a trigger for a lot of people, but basically it happens for pregnancy, during pregnancy itself, right? So of course, what are the people who are at risk of suffering from hypertension during pregnancy? The risk factor is people who suffer from chronic kidney disease, like we mentioned, diabetic patient, autoimmune disorder patient, and people who already having chronic hypertension, of course. When you go to when you are pregnant, then you're having a bigger problem, right? Now, what are the other risk factors for people who might suffer from preeclampsia, which is basically the pregnancy hypertension during pregnancy? Is when you are actually giving birth age older. That means you're older than 40 years, then you give birth. You then likely to suffer from hypertension itself, right? Your pregnancy interval is greater than 10 years. That means that you're between one first and the second born, maybe more than 10 years left in between, right? Or you are obese, or you're overweight, BMI is already 35. So, or you have a family history. Now, of course, having hypertension during pregnancy have a lot of implication itself, right? On mother itself, actually, you can cause future hypertension, cardiovascular diseases, liver failure, a seizure, diabetic, or for the baby itself, actually, you will have a problem of preterm delivery, growth restrictions, respiratory distress, and so on, the stillborn birth and all that itself. So therefore, it is very important to avoid or control or manage hypertension during the pregnancy. And of course, I think that in Singapore context itself, you will be well taken care of by your doctors because if you suffer from it, the doctor will know how to manage it itself. All right. Okay, now let's look at the major cause, the primary hypertension, right? This is the one that hypertension that without a known specific cause, right? Now, what are the approach we have to prevent or control that itself? The first line approach actually is lifestyle modification because there's no known causes of hypertension. And 85% of us are actually suffering from this form of hypertension itself. So what are the recommendations if you were to go to see a doctor, right, or even a healthcare professional? What is the current first line treatment option? First is lifestyle modification, which basically you follow the following guideline. Very simple, right? One, weight management, control your weight, do not overweight. Second, have regular exercise, right? We'll talk about exercise a bit later for you. We have a proper healthy diet. In this case, we will recommend you actually follow a DASH diet, which is a diet that actually very similar to Meridian diet, except that it's actually with a focus on the salt reduction, healthy diet. Then try to moderation in the alcohol drinking, and then of course having a healthy eating patterns itself. Then if you're a smoker, stop smoking, right? And learn to manage your stress. Do not overstress yourself. So the guidelines are very simple, right? But I think that it's important to know that how this what we recommend here, how does it impact and affects that. A lot of people doesn't seem to take this as seriously because they think that this is a thing that generally you do, but might not be effective in controlling hypertension. But it's not true. I'll show you some statistics on that. Now, just before we go on to detail of that itself, now here I have just a short note. For people who suffer from hypertension itself, there is actually a TCM acute point that you can apply to manage it. Right? These are very useful, small tactics that you can apply on yourself. This is a massage that you can do on yourself, right? So there are 2 points. For people who suffer from hypertension, you can actually massage it regularly every day, and it will definitely, in the clinical context, it actually have proven to be beneficial for people who suffer from hypertension. Now, one of the points is actually the Tai Chung Xue, which is actually the weight point here that is just between the two bones of your of the legs, and you can see from here, right? This is the point whereby you do your massage yourself. You can massage there, right? You can press it. Use your finger to press it for 20 to 30 seconds each cycle, and then you actually do about 6 cycles a day for both of the leg. Another point is actually in here. You can see from here the KID3, Tai Chi Xue, Tai Chi Xue. This one again same. You can use your finger to press on this point, and again do a 20 to 30 seconds each time, and then release it, and then repeat the cycle for about 5 to 6 cycles, right? And every day, it will help to relieve and moderate your blood pressure as well. It's been proven quite effective. In fact, if you look at it itself, even there's in Western medical literature itself, there's a meta-analysis that actually have studied how effective is the TCM acute point, and they do actually confirm these 2 points are effective for management of hypertension. Okay, now let's look at the physical exercise. Now, we all know exercise is beneficial, but how beneficial to the blood pressure, how effective is it itself? Basically, I think this is a chart that show you, right? The point in here is that, right, you can see from here the chart of exercise, that means the amount of exercise you have in here, and the effects on your SBP, DBP, right? For that, you can see from here that both male and female, basically, I just didn't put in the clarification here. But basically, you can see that for exercise itself, right? When you exercise, up to certain point, the reduction of your blood pressure will actually lay flat over time. So that means that you do not actually have to exercise very vigorously in a long time. You actually need to reach an optimal point of exercise. And beyond that, the benefits are not significant, right? So that means that you don't push yourself. So what is the optimal point? If you look at this study itself, it shows you that the best optimal point for exercise to help reducing your blood pressure, okay? In fact, the blood pressure reduction is quite high, you must know. A lot of people don't believe exercise can help, but this, if you look at this chart itself, the reduction actually is quite high. It's close to about 5 point to 6 point itself, the reduction in that. You see 7 point to 5 point. 7 point on the high side, SBP, and 5 point on the DBP side itself. your exercise, best optimal exercise is 150 minutes per week point. Right. So if you can exercise every week 100 to 150 minutes per week, right? You are able to help to reduce your blood pressure, right? In fact, this is one of the most effective way of reducing blood pressure for people who are suffering from primary hypertension. So remember, you don't have to exercise a lot. You just have to hit this target itself. This will be actually a good optimal point for you. Okay, let's look at the diet itself, right? So, wow, you say diet, then if you say healthy diet, everybody know, right? And then if you have a diet with your sodium restriction, we call it the DASH diet itself, right? And a DASH diet basically very similar to actually the Meridian diet, except that they focus more on actually reducing the sodium intake itself. Now, here are clinical data confirming how effective is actually the DASH diet in reduction of your blood pressure itself. So both for the SBP and the DBP, the DASH diet, which is actually the low sodium DASH diet itself, the red mark itself, you can see that there is a very significant reduction in the blood pressure. The higher the person who are suffering from hypertension, that means in this case, you see that if your hypertension is actually above 150, right? The quantile of drop cell reduction is much more significant. Right. For instance, if you are suffering from a stage 2 hypertension, right, your SBP reduction actually is about close to 10-point reduction itself. So this is very significant. Right. So the diet does play a significant impact on your blood pressure itself. So remember, the higher your baseline blood pressure is, the more effective is actually the DASH diet on your blood pressure reduction. Okay, now we talk about sodium, right? But we also need to talk about another minerals, which is called potassium. Potassium is a mineral compound that present in a lot of we call healthy vegetable and fruits. Right? You can see from here, it's a very common one. Most of the vegetable and fruits that we consider healthy contain very high amount of potassium itself. Right? Now, important, you look at this chart, I will show you, very important for us to understand here. First of all, right? Potassium, if you not enough potassium, because potassium deficiency itself, you will have hypertension. Which means that if you don't eat enough of potassium in the diet and you are potassium deficient, then you can see from this chart is that whether you are hypertensive person or normal healthy person itself, it will increase your blood pressure. Both SBP and DBP also will be affected. So you can see that if you are eating less than the optimal 90 mmol per day of potassium in the blood, this measure in the blood, of course, I'm not talking about the amount you're eating. So if you are eating less than the nominal expected amount of potassium in your diet itself, then you are likely to have an increase in your blood pressure. This chart shows that when you have potassium less, the blood pressure go up very significantly itself, right? So in this case, remember, if you are a hypertensive person, your lack of potassium intake in your diet will affect you more than a normal person. So more so for hypertension patient, right? You must take in adequate amount of vegetable and healthy fruits, because the fruits that contain potassium itself will reduce your risk of having hypertension due to lack of potassium. So it's not sodium alone, potassium also play a role, right? So take more potassium-rich food itself. Now, on the other hand, right? Now, why do I want to talk about excessive potassium is because Atomy have a very famous juice called noni juice, which is very rich in potassium. So after hearing what I say just now, a lot of the member might go in there and drink a lot of noni juice. That is what I'm worried. So I'm going to put in this chart to tell you that, look, right, dietary intake of healthy vegetable and fruits which contain potassium is okay, because that it will be suffice to actually prevent you having potassium deficiency in potassium. But if you are taking overdose of potassium, right? For instance, if you look at in the market, there's no potassium supplement. You notice that there's no such supplement called potassium supplement. Nobody sells potassium as a supplement. Why? The reason is very simple in here. In this chart itself, right? This chart shows that compared with people with hypertension people, right? Now, let me put it that way. If you are on hypertension, you're hypertension people and you're on medication, right? So, and with the hypertension medication, you are controlled. Your medication, your blood pressure is controlled. Then, if you take in excessive potassium in your diet, excessive potassium in the diet itself, you can see from here that this chart shows you that the excessive potassium will increase your blood pressure. For people with taking hypertension medication, so this is actually one of the very important consideration for not overtaking, not excessive taking potassium itself. Now, if you are not taking any hypertensive medication, then if you were to take excessive potassium itself, the risks are not there, which means that basically you will see that in this chart itself, it doesn't really increase significantly any of your blood pressure unless you are very, very high in a very high end. Otherwise, their blood pressure is not affected. But if you are taking a medication, remember taking the hypertension medication, and the hypertension medication together with excessive potassium intake will cause your blood pressure to go up. So this is actually contraindicated. So remember that excessive potassium is contraindicated to hypertensive medication. So don't take excessive amount of noni juice, right? If you are already on hypertension medication, and if your hypertension is already in control, there's no need for you to overdose on noni juice, right? Remember that. Okay, now coffee, very interesting. So here basically show you that that's our last study, and in fact this study is quite good because it actually is give you a very credible outcome of 20 meta-analysis of so many clinical studies combined, and the result conclusively say that okay, certain amount of coffee, reasonable amount of coffee a day will help to reduce hypertension or risk of hypertension. So it's good news for people who are hypertension and for coffee drinker, because if you drink coffee, not excessive, but a reasonable amount of cup coffee per day actually will help to reduce the risk itself. Okay, now let's talk about the food, but before that, we talk about nutraceutical means food that we can take, and what are the food that contributing to lower blood pressure. Now here we talk about two. One is the herbs. One is actually what they call the spices itself. Both are actually considered as food. So we are not there for you to go and take specific except for pented ginseng. Ginseng itself. Ginseng can be taken as a supplement. But here show you that the efficacy of actually the herbs, both hibiscus as well as ginseng, in terms of reducing blood pressure. Also the spices. The spices are also actually listed in the order of the potency. Garlic is having a very strong potency in efficacy in reducing blood pressure. The SBP reduction is about 8 point, DBP about 6 point. Next is celery, followed by ginger, and followed by cinnamon. So therefore, it's actually beneficial for people who are suffering from hypertension to actually take garlic, celery, ginger, and cinnamon. In fact, there are some friends of mine actually that was talking about if you are having hypertension, you should try to regularly drink celery juice itself. Yes, celery have shown that actually are able to reduce the blood pressure quite okay, quite significantly, about average of 7 point reduction in the blood pressure for people. Of course, ginseng also have, but ginseng are not as potent as all these spices here as compared. But having said that, ginseng have other benefits, multifunction benefits we will discuss a bit later. But ginseng also actually are reducing blood pressure. So a lot of people might have a misconception that actually they think that drinking ginseng will increase the blood pressure. It's not true. Ginseng might increase your heatiness, but heatiness are not the same as hypertension, having hypertension. So ginseng basically are able to regulate the blood pressure. In fact, it reduces blood pressure, reduce blood pressure itself. Okay, now what are the supplements that's effective and we can use for people who are suffering from hypertension? I think this probably is the juice of the whole whole seminar itself. Right, you can see from here that rank in the order of potency again. Right, coenzyme Q10 have the highest level of evidence and actually highest level of efficacy in reducing hypertension among the supplement itself. Unfortunately, the coenzyme Q10's potency, the effects on the hypertension are not a linear curve. You have a J dose response effect. I will explain in the next slide itself. What does it mean itself, right? But having said that, among all the supplements I listed here, coenzyme Q10 is the highest potency supplement for reducing blood pressure. So followed by L-arginine, right? Followed by alpha lipoic acid, right? These two probably for the Atomy members, you all probably are not familiar, but these are common supplements have been taken also for reduction of blood pressure. Then we have the nattokinase itself. The evidence are moderate and the efficacy are also moderate. Basically, it's about 3 point and 2 point on the SBP and DBP itself. Then followed by omega-3 fatty acid, which is the fish oil itself, right? The evidence are actually a bit mixed, and with a J dose response effect, I will explain a bit later. And the effects on the BP are not that high. It's about 2 point, about average about 2 point only. So really, omega-3 are not really so commonly used for people who have hypertension to reduce hypertension. But omega-3 is taken as a good supplement to prevent the complication of hypertension, right? So it itself is not so potent in helping in reducing hypertension, but omega-3 is a very good supplement to be taken for people who suffer from hypertension because it actually is a very good supplement to prevent cardiovascular diseases itself. So then followed by the magnesium itself. Also, I put it there is because magnesium also have some small effects on reducing the blood pressure. And in fact, some of you might be aware that when you have hypertension, some of the friends might recommend, hey, take some magnesium, it helps. Yeah, it helps. The amount of the hypertension, the effects of it itself is not that high itself. And also actually you have a dose response effect, which means that what I mean whenever you have to say dose response effect means that you depend on the dosage itself, and the dosage can actually be a dosage that you overdose, you might have a different effects itself. All right. So let's look at the coenzyme Q10. So coenzyme Q10, since it's the most potent supplement, although that Atomy might not have a coenzyme Q10 product, but I want to make sure that now when we talk about this during hypertension, when we talk about supplement itself, you do not actually want to restrict yourself just only because Atomy doesn't have the product. You do not want to address the issue. Just keep it. But you want the best option to address the issue. So this is very important for people who choose to take coenzyme Q10 to help to reduce your blood pressure itself. Now, here is what I mean by the dose response, J response shape, response effect of it itself. Now, you can see from here for the SBP and the DBP itself, right? Coenzyme Q10, there is an optimal dosage amount where you take. When you take in this range of between 150 to 220 milligram per day of on coenzyme Q10, you have the best drop in your SBP and the DBP. The blood pressure actually drop. You have the best drop in there, right? But if you overdose on your coenzyme Q10 and up to the point of 300 mg per day itself, you can see in this curve itself, your blood pressure begin to go up. So there is a limit of overdose that you have to be careful. So the optimal dosage for CoQ10 is between 150 to 220 milligram per day. And you should keep your CoQ10 supplement below 300 milligram per day, especially for people who are suffering from hypertension and you want to reduce your your blood pressure. Okay, so very important. So this also tells you that this is the rarity of supplementation for every one of you. All right. So when you take supplement, doesn't mean more is better, right? You must choose the right dosage so that it can be effective. Not enough is not going to be effective, but if you overdose, you also can have adverse effect. And this is a very classical case of adverse effects of overdose. And that's why that remember very carefully that whenever, even if you take supplement, remember that you must recognize what is the best dosage you take. Do not simply take and do not think that taking more is better. Okay, now omega-3, again, I put it that way because omega-3 is a very useful supplement and it's a supplement that have a very broad spectrum of benefits. And in fact, in Atomy, there's 2 omega-3 product itself. So therefore, I want your application side in terms you're aware of what to apply and when to take and take appropriately. In here, right, put it that way. Here we show people who have a hypertension person group. We have a normal, non-hypertensive group, a healthy group. We have people who suffer from hyperlipidemia group, and we have people who are normal and no hyperlipidemia group. All right, and you show the effects of the dosage of omega-3, the fish oil you take. As the fish oil you take increases, how is the blood pressure reflected? So it's just to summarize. Okay, now except that you are hypertensive person, that means except that you are suffering from hypertension, right? Then if you take high amount of omega-3, the fish oil, it will still benefit you because the blood pressure is still dropping. This is the green box. This green box shows that for hypertensive patient, your amount of EPA and DHA increases, your blood pressure still go down. So this is beneficial for people who are having hypertension, right? But for people who are not suffering from hypertension, if you take excessive amount of fish oil, more than 5 grams, you will see that your blood pressure go up, SBP go up, right? Same thing, if you are suffering from hyperlipidemia, that means that you're suffering from your cholesterol problem, right? And if you take excessive amount of fish oil or EPA and DHA above 5 grams, your DBP go up, your blood pressure, the lower blood pressure go up. While your upper blood pressure doesn't go up, your lower blood pressure go up, right? Now, if you are not suffering from any of the lipid disorder person, if you have excess dosage of fish oil, your SBP pressure go up. So therefore, there is a limit of fish oil intake. Right. The limit in here, you can see from here, is that you do not take your fish oil more than 5 grams a day because of this condition. Right. So although that if you are having hypertension, if you take more than 5 grams, maybe it's still okay. But generally for people, for most of us itself, there's no need for us to take more than 5 grams of fish oil a day, because more than that itself, in fact, it increases your blood pressure. It's not helping your blood pressure, right? So remember, so this is also a typical case of supplementation. That why you want to know exactly what is the dosage you take. You do not take more than necessary. If you take more than necessary, the reason is very obvious. In here, in fact, it make it worse for you. In fact, your blood pressure go up itself, right? Okay, now this is Atomy blood pressure lowering supplement. So we have listed here. I've listed here actually 4. But out of the 4 itself, you can see that the ginseng you have discussed, right? The ginseng blood pressure reduction is this amount, right? And then we have the omega-3. Omega-3, actually, there's 2. I will list the RTG omega-3. Omega-3 itself. So this is RTG omega-3. The reduction is about 2 points for both SBP and DBP, right? Then we have a nattokinesis itself. Actually, nattokinesis and ginkgo and nattokinesis actually is a very good combination that actually have shown. You can see the potency of reduction of the blood pressure is actually in fact quite high for the SBP side, right? Although the DBP are not that high, but the SBP basically is quite high. You can see that about 5.5 points itself, right? So also magnesium, I'll put it here because I'll just mention here. Magnesium also can be helpful, but magnesium are not really recommended for people who just want to reduce blood pressure. Okay. Okay. Now let's look at the ginseng quickly. All right. Now here, ginseng itself, I just want to let everybody know that basically in the market, we have actually the Asian white ginseng, the Asian red ginseng, which is the Korean ginseng. The white ginseng is the Chinese ginseng, right? And the Western ginseng, which is the American ginseng itself. Now, basically, the Korean ginseng and the Chinese ginseng belong to the same species. So basically, they have the same pharmacological property and function, right? Now, we do not consider American ginseng as the same, so therefore they are of different species altogether. So in Atomy itself, right, the famous Korean red ginseng extract, Homsandan, right, it is actually very standardized, very actually what I call therapeutic, in a very therapeutic form, because it is a highly standardized red ginseng extract that have high concentration of ginseng oxide. So this one stick of it itself will contain about 1 gram of ginseng concentrate. And inside the 1 gram actually is 20 milligrams of ginseng oxide, which is the active ingredient of ginseng. Now, the key thing is that it is a standardized form, right? That means that you can use it as a medicinal dosage, because it's very consistent in its active ingredient and its potency in terms of effects. So what are the actually application itself? Right, you can see from here, the application of ginseng are very wide spectrum. Number 1, improve mental and physical performance, especially for people who are having chronic fatigue syndrome. This is a very powerful herbs that can actually beneficial for people suffering from chronic fatigue syndrome. Then if you're suffering from impaired memory, dementia or Alzheimer's diseases itself, right? Ginseng also is beneficial to you. And also ginseng is useful for lowering the LDL. We talk about cholesterol, improving the good cholesterol, and then also help lower the blood sugar level for diabetic patient. Then in here, of course, we just mentioned that helpful in hypertension, helpful for heart failure. As ginseng also is helpful for arrhythmia and cardiac hypertonic, and CAD itself, right? And of course, it also been so cited that ginseng also is useful for people who suffer from respiratory tract infections, and also is used for erectile dysfunction supplementation. Okay, now precaution for Homsandan, right? First, Homsandan, the great ginseng, is not suitable for people pregnant, breastfeeding, children under 6 years old, not suitable for people who suffer from severe kidney diseases, severe liver diseases, and also very important, suffering from bleeding risk like aneurysm itself, right? Now, key thing in ginseng taking is that ginseng interact with a lot of medication, especially Western medication itself. So do not combine them in intake. You need to space them, right? You need to be careful about that if you are taking any of these medication, especially the painkiller, steroids, estrogen, so aspirin as well, for instance. So be careful about that, and remember that if you are taking this medication, first, space between the medicine and the ginseng intake. Second, do not overdose on the ginseng intake. Do not overdose. Stick to the normal recommended dosage of 1 pack a day. Okay, now the omega-3, Atomy have 2 products, RTG and Alaska omega-3. They are basically the same, right? Now here, basically, I just briefly mentioned that the omega-3 actually have benefits in lowering the triglyceride and have benefits in increasing the HDL. These are the key benefits of actually Alaska omega-3. Now here are the dosage that is actually recommended for people who want to take it as for therapeutic purposes itself. So 4 grams daily for CVD patient. Symptoms of depression. Actually, omega-3 is very good for people who suffer with depression. So it doesn't hurt for you to try. About 2 grams per day, 1 gram twice daily, right? Your supplement for reducing risk of heart attack is about 2 grams daily, and also 2 grams up to 4 grams for people who want to reduce the triglyceride and blood on hyperlipidemia itself. So it's important to know that what we mentioned is that do not overdose on the omega-3 itself. Here, I want to repeat again as what I mentioned just now. Right, first of all, do not take more than 5 grams per day of the fish oil in total. So as you see earlier, I explained, right? If you are taking more than 5 grams a day, you might actually increase your hypertension, your blood pressure as well. Now, another precaution for people who are taking fish oil is very important. Is that fish oil is very often taken for people who have cardiovascular diseases. They want to take it as a supplement for maintenance. But there is a group of cardiovascular diseases patient that is actually suffering from irregular heartbeat, because arrhythmia itself. They are not suitable to take fish oil. So there's enough study here to show that actually taking of what we call omega-3 fish oil, right, increase the risk of arterial fibrillation, which is actually increase the risk of irregular heartbeat itself, right? So do not take if you are suffering from irregular heartbeat. In fact, you can see from here this study, right? Greater than 1 gram per day correlate with a 50% increase in arterial fibrillation risk itself. So it's important, please note. So these are one of the few latest findings on the fish oil. And so therefore, it's very important when you want to take fish oil, 2 things. 1, do not overdose. More than 5 grams is the limit, right? Second is that if you are check whether you are having irregular heartbeat. Okay, now ginkgo and natto, as we say, is one of the very good combination. In fact, it's a very good product found in Atomy range for hypertension. right? So you actually can improve your SBP a lot. It doesn't improve your DBP higher, but then it's quite good for people who have the high number high. It's quite effective itself. So the dosage are all here, the application are all here. I will just keep it for you all to do your own reference. Incidentally, I have actually downloaded the soft copy, but then if you want me to download again, I can download for you all to take it as a reference. Okay, now important for ginkgo and natto, this product itself, bleeding disorder, people who suffer from low blood pressure, and people are going for surgery itself, please, you are contraindicated. That means you should not take natto and ginkgo and natto. All right, so important, and especially people who suffer from low platelet count. So you are suffering from low platelet count. Low platelet count can be caused by a lot of things like viral infections or dengue fever, or people on chemotherapy treatment, or people who suffer from heavy alcohol consumption, right? Or people suffer from leukemia, right? Those are people that usually will have low platelet count, and low platelet count patients should not take ginkgo and natto, because it will increase your risk of bleeding. All right. Okay, this is the end of my session.